Hi, and welcome to Crack the Board. If you're new to this channel is dedicated to helping you excel in the USMLE by offering over 2,000 questions, complete with answers, detailed explanations, and the rationale to deepen your understanding. We upload 2 new videos every week, so be sure to subscribe, like, and share to support the channel and stay updated on the latest content. In today's video, we'll focus on USMLE questions related to pharmacology. Let's have a look at the first question. A 60-year-old man presents to the emergency department with severe pain in his left eye and reports seeing halos around lights. Physical examination reveals a markedly red left eye and a cloudy cornea. He's diagnosed with acute angle closure glaucoma and initiated on pilocarpine eye drops. Which adverse effect is this patient most likely to experience? A. Blurred vision. B. Bronchospasms. C. Constipation. D. Sinus tachycardia. And E. Urinary retention. The correct answer is A. Blurred vision. Adverse reactions to pilocarpine when applied to the eye are usually confined to ophthalmic effects, although systemic reactions can occur. Myopia, blurred vision, and night blindness are fairly common. Let's have a look at why the other options are incorrect. B is incorrect because exaggeration of the parasympathetic effects such as asthenia, chills, dizziness, bronchospasm, lacrimation, rhinitis, tremor, increasing urinary frequency occur mostly with oral rather than with the ophthalmic administration of pilocarpine. C. Constipation is incorrect as pilocarpine may cause diarrhea rather than constipation. Option D is incorrect because cardiovascular adverse effects such as sinus tachycardia and hypertension are reported with oral administration of pilocarpine rather than ophthalmic preparations. Option E is incorrect because urinary retention can occur with anticholinergic agents, whereas systemic pilocarpine, being a cholinergic agonist, can increase urinary frequency. Let's have a look at the second question. A 7-year-old boy presents with irritability, severe abdominal pain, and headache. Physical examination reveals muscle weakness, including left wrist drop. Laboratory tests show microcytic anemia and increased free erythrocyte protoporphyrin levels. A peripheral blood smear shows coarse basophilic stippling. What is the most likely cause of his symptoms, and what would be the recommended treatment? A. Acetaminophen poisoning. B. Arsenic poisoning. C. Iron poisoning. D. Lead poisoning. E. Mercury poisoning. The correct answer is D. Lead poisoning. Lead affects major organ systems such as the central and peripheral nervous system, the Him biosynthetic pathway, and the renal system, with related injury to the cardiovascular system. At low concentrations, lead poisoning can cause cognitive impairment, language delays, and behavior problems. As concentrations increase, symptoms progress to vomiting, colicky abdominal pain, fatigue, renal insufficiency, and encephalopathy. Children with lead encephalopathy typically have elevated levels of blood erythrocyte protoporphyrin or zinc protoporphyrin, both of which are precursors of Him and arise due to lead's inhibition of Him synthesis. Basophilic stippling of red cells caused by aggregated ribosomes appears as increased basophilic granulation when stained. Let's have a look at why the other options are incorrect. Option A is incorrect, as free radicals formed from acetaminophen metabolism cause lipid peroxidation of hepatic membranes and lead to hepatic necrosis. Early manifestations of intoxication with acetaminophen include mild gastrointestinal complaints. Later manifestations include hepatic failure, encephalopathy, and sometimes death. Answer B is incorrect, as symptoms of intoxication with arsenic may include gastroenteritis, leukopenia, anemia, mei's lines in the nails, alopecia, neuropathy, and encephalopathy. Option C is incorrect, as early manifestations of acute intoxication with iron include abdominal pain, hematemesis, and bloody diarrhea. Later manifestations may include shock, which occurs secondary to the loss of fluid and blood into the gastrointestinal tract, and then it can even cause hepatic failure. Option E is incorrect, as manifestations associated with mercury intoxication vary depending on the form of mercury to which the patient is exposed. Intoxication with elemental mercury may cause tremor, gingivostomatitis, and neuropsychiatric disturbances such as fatigue, memory loss, shyness, depression, and irritability. Intoxication with inorganic mercury may cause acute hemorrhagic gastroenteritis, renal failure, and acrodynia. Intoxication with organic mercury may cause paresthesias, ataxia, dysarthria, and other disorders of the central nervous system. Let's have a look at the third question. A 36-year-old woman reports sneezing, congestion, a runny nose, and red itchy eyes. She notes that her symptoms do not follow a seasonal pattern and tend to improve when she goes on holiday to different cities. She's prescribed fexofenadine. Which receptors does fexofenadine target to help relieve her symptoms? A. Alpha adrenergic receptors. B. Beta adrenergic receptors. C. H1 histamine receptors. D. H2 histamine receptors. E. Muscarinic receptors. The correct answer is C. H1 histamine receptors. This patient most likely has non-seasonal allergic rhinitis caused by an allergy to house dust. Fexofenadine is a second-generation H1 histamine receptor antagonist that blocks the histamine-mediated allergic response. Let's have a look at why the other options are incorrect. A. Alpha-adrenergic receptors are incorrect because pseudoephedrine and related indirect acting sympathomimetic agents such as oxymetazoline act to stimulate alpha-adrenergic receptors and cause vasoconstriction of the nasal mucosa. Option B is incorrect because beta-2 adrenergic agonists such as albuterol and terbutaline are used to treat bronchoconstriction seen in asthma. In contrast, non-selective beta blockers such as propranolol can cause bronchospasm and hypoglycemia. Option D is incorrect because fexofenadine is H1 receptor specific and does not target H2 histamine receptors. Option E is incorrect because fexofenadine is a second-generation antihistamine and has minimal effects on muscarinic acetylcholine receptors. First-generation antihistamines such as diphenhydramine have prominent antimuscarinic effects such as dry mouth, drowsiness, and constipation. This concludes today's set of questions. Thank you for watching today's video. If you enjoyed it, please don't forget to subscribe to the channel to stay updated on our latest content.